Right, so. Okay, we sorted.
I can crop. So
you can crop, thank you. Oh, hello everybody, welcome to our 12th Network webinar. Actually this is not the webinar that went live a couple of weeks ago because we had a bit of a technical issue. So we've been very lucky that our two presenters, Rhiannon Evans and Gillian Gray, have agreed to be recorded again. So that is what's going to happen now, and we very much look forward to hearing what they're going to say. So I'm going to hand over to Rhiannon Evans, Dr. Rhiannon Evans, who has done some other webinars too, so you may well recognise her. So welcome.
Hi, hey everyone. So today we're going to talk primarily about well-being of students in school and trying to think about how is it that we can best try and improve well-being of students, and thinking really about the primacy of relationships within that, and how perhaps it's the everyday relationships within school which might be key for us improving student well-being. So I'm just going to talk quite broadly really about well-being and relationships, and then our colleague Jill Gray then is going to talk more specifically about the WISE study that we've been doing, which some of you would have been involved in. So this is a trial which runs in England and Wales with the aim of trying to improve the well-being of teachers, which in turn then can improve their relationships with students and hopefully positively impact on student well-being. So this is going to be the title, which is the importance of relationships to staff and student health, building theory. So I have just touched upon this, so I'll talk about the importance of school-based relationships, and then Jill will talk about the WISE study specifically, and then I'll consider the implications moving forward about what it is that we should be doing to try and improve student and staff well-being. So the first thing really is just to reflect on what we've seen happen with the wellbeing agenda, specifically within Wales, but also internationally. So many of you will know from your own experience that over the last 20 years, there's been a massive drive towards prioritising mental health and wellbeing of students. And we have seen this come up in a range of different forms. So particularly in the 90s was this focus on emotional intelligence. Then we saw a lot around the social and emotional competency. So specifically, we would have seen social and emotional aspects of learning intervention, which would have been in the late noughties and the earlier part of this decade, so up until about 2011. And then alongside this, particularly in the US, we've seen a lot of positive psychology and even the happiness agenda, which has come in and out of trends. So I mentioned there a couple of the key types of interventions we've had, which many of you will have experience with. So SEAL, Thrive is a common one that I know a lot of schools currently use, and the PATHS curriculum, which is the American intervention, which is used quite commonly in England, but is starting to gain some popularity in Wales as well. So the evidence base really for these interventions has been mixed. So we are seeing more and more evidence to show that we can improve students' mental health within the school context. And in the last couple of weeks, a study's come out in the Lancet actually about the inclusive trial, which we could probably do a seminar about, a webinar about that really being quite an effective thing. But yeah, but equally a lot of these interventions, for example, the PATHS intervention hasn't necessarily been shown to be effective in the UK, even though it was effective in the US when it was originally evaluated. And a lot of the problems that we've seen are linked to low levels of implementation. So essentially when schools get busy, when core business happens, so when they might have examinations, for example, these things get pushed to one side often, and we can see a lot of variable implementation. But there's also some critique that a lot of the interventions that we have seen focus on individual level causes and solutions. So a number of interventions focus on trying to improve students' competencies around their own mental health. So what we were kind of interested in is, well, actually not just focusing on the individual per se, but trying to think about more broadly about social relationships and their link to both the school and to the individual teachers, etc. within the school. So just to start off a little bit, really think about the importance of the student and their relationship within the school. And a key thing here is about socio-economic inequalities and the role of family deprivation, but also school level socioeconomic deprivation. So from the Joan data, we know that socioeconomic inequalities are often greatest in the more affluent schools. So essentially schools where there are relatively low levels of preschool meal entitlement, we have much more inequalities between the individual students. But also what we see, which is really interesting, is that the benefits of attending a more affluent school tends to be limited to those children that are from more affluent families. So if you have a school with a low free school meal entitlement or eligibility, then really the academic benefit of going to that school tends to be limited to those families which don't receive free school meals. And what we see, which is quite troubling, is that it's the young people from the poor families have worse well-being when they attend more affluent schools. So this might feel slightly counterproductive, but essentially students that are from more socioeconomically deprived families may benefit their well-being more when they go to schools which have lower free school meal eligibility than those which, when they go to schools which have high levels of free school meal eligibility than those are lower. And this is what we know to be the frog pond effect. So it's essentially that they're in an environment perhaps where they're less familiar to them. So there might be negative social comparisons where there are more affluent students in that school, but also there's a sense that those schools might cater more for more sort of middle class affluent students, just in the way that they talk about the world around them and the types of things that they teach. Then we've also, what we found from the Joan data is about that sort of family level preschool meal eligibility and its links to relationships. So students from more affluent families tend to have better relationships with their teachers, they tend to have better relationships with their peers, and they feel more involved in school decision making. But what's not quite clear is the link of these things with school level socioeconomic status. So actually what we saw is that young people who are in poorer schools tend to have the best relationships with their teachers, particularly if they're from a poorer background. So this is again the sense that, I guess the idea that perhaps going to a more affluent school would be better isn't always true, and relationships are a key part really within that situation. Continuing then on the theme about relationships, what we saw was that the perceived quality of student-teacher relationships was associated with all measures of health outcomes. So this was primarily well-being and substance use, but was not related to physical activity. Furthermore, positive peer relationships were associated with improved health outcomes, again well-being primarily, though not substance use. And we saw also that good quality relationships with teachers, reduced bullying, low levels of dating violence was associated with reduced risk of substance use and increased subjective well-being. So essentially from that is thinking about the type of schools that students go to is important for their well-being, and how they fit with other students within that school is important. But it's also really the centrality of relationships within that setting, both relationships with their teachers, but also with their peers, and the nature of relationships that they have are really, really key for us understanding the patterning of well-being, but also thinking about how we can do something then to improve student outcomes. Then the final sort of key set of data here was thinking about a paper that we have on well-being outcomes and wider health outcomes for those individuals that have resided in foster care. So we know on balance that children who are in foster care that were registered as such in the Joan data are more than 9 times as likely to use methadone, more than 3 times as likely to have multiple misuse, substance misuse behaviours, and more than 70% more likely to have poorer well-being than students in the school who have not been in foster care. And it's thinking about, well, how might we explain these sort of outcomes? And this is not a causal relationship, what I'm about to say, but they might give associations which feel meaningful to us. So those individuals who have been in foster care are almost twice as likely to have poor relationships with their peers, almost twice as likely to have poor relationships with their teachers, more likely to experience bullying, and more likely to experience dating violence. So we can see really the importance of those relationships within that particular population, and that they might be meaningful ways in which we can intervene, which focuses a little less on individual skills and competencies. So I'm just going to hand over to Jill now, and she's going to talk about the wellbeing study.
Oh, thanks so much, Rhiannon, because we've had some webinars on some of those subjects, but to bring them all together, I think really makes you start to think about all of these issues. So thank you very much. So, Rhiannon and Jill are just going to swap places, and I'll just stay static. So, hi Jill, thank you so much. So you're going to talk about the WISE study?
Yeah. So the WISE study is obviously wellbeing in secondary education. So just to give some sort of context, context to the study is, we've all seen the headlines around mental health crisis for children and young people. And unfortunately, the problem does appear to be getting worse. And a survey conducted by the Department of Education in 2014 with children in England, in schools in England, in year 10, so that's the 14 to 15 age group. They reported that over 37% of girls and over 15% of boys reported being psychologically distressed. And if you can see from the slide, this is an increase in less than a decade, of almost double for boys and almost 3 times more for girls. So that is quite a worrying statistic. So positive mental health and well-being in adolescence is associated with positive social relationships, development of healthy lifestyles, reduced risk of adverse socioeconomic outcomes, psychiatric disorders, self-harm and suicide in later life. And almost 75% of adults who do experience depression have actually reported that this has started in adolescence. And that really highlights the importance of identifying risk factors of poor mental health in this age group. Mental health of teachers. Teachers are consistently reported to be at risk of increased mental health problems. They experience higher rates of stress, anxiety and distress at work. Impact of this can be longer poor mental health problems, poor performance at work or presenteeism as it's known, sickness, absence and early health-related retirements. And not only is this detrimental to teachers' own health, but it can have implications for the quality of relationships they have with students and their ability to support students who are in need. Presenteeism may have an impact on students' mental health through teachers not being able to develop positive and supportive school environments and finding it difficult to manage classroom behaviour effectively. An overview of the WISE study. So WISE obviously stands for Wellbeing in Secondary Education. The WISE study is a 3-year cluster randomised control trial. It's cluster because it's organisations, not individuals. 25 schools took part in southwest England and south central Wales. 12 schools, so that would be 6 in Wales and 6 in England, were then randomly assigned to receive an intervention to improve wellbeing in schools. The intervention looked like it was 8% of teachers who had a pastoral role in the school undertook a 1-day mental health training for students. And this was to better equip them to recognise early signs of student distress and enable them to feel more confident in offering support to those students. An additional 8% of school staff who had been nominated by their colleagues when we collected baseline data through the baseline questionnaire before putting the intervention into schools. They undertook a 2-day standard or adult mental health first aid training, And this again was to better skill them at providing support to colleagues who may be experiencing psychological distress. So they were skilled up to listen without judgment, deal with panic attacks, and where necessary, encourage colleagues to seek further help. These school staff who'd had training then went on to set up a peer supporter service. So it was a confidential service, accessed directly, so people didn't have to go through their line manager. And it was really a first port of call for colleagues who were experiencing distress. If it was a problem that the peer supporters were felt needed more skilled services, they would then signpost and encourage their colleague to go to contact those services. The aims of the current study, we drew on self-reported survey data that was collected from baseline from all teachers in the 25 schools and Year 8 students. So this was the 12 to 13 age group. And the study investigates whether scores, we averaged the scores of teachers, so it's scores for wellbeing and depression. And we wanted to see whether they were associated with individual scores for wellbeing and psychological difficulties for students. So we had to average the scores for teachers because in secondary schools we can't be sure which teacher has taught which students. So we had to do it on that basis. So we aim to sort of obviously look at those associations. So how is teacher wellbeing associated with student wellbeing? And it aimed to identify possible explanations of those associations by examining whether the strength of those associations are weakened when we take other factors into consideration. So we took other factors such as the quality of teacher-student relationships, teacher presenteeism or work performance, and we also looked at teacher absence. And so to account for associations that may be due to any shared features in the school environment, we also looked at school level factors, so that would be school size, the performance of the school, so by looking at ESTIN and Ofsted ratings, and whether it was academy status or not. So obviously schools in Wales are not academy status, so they were marked down as not being academies, and also school attainment. So we included those in our analysis. So the method how we sampled participants. So student, teacher and school data were taken from all 25 schools, as I said earlier, in England and Wales who participated in the WISE study. Schools were recruited from in the southwest of England via 4 local authorities, and in Wales via 10 local authorities. As I said earlier, all students were in Year 8, so they were aged between 12 and 13 at baseline, and all teachers were invited to take part in the study. The questionnaires that we used to collect the data, they're very well-known questionnaires. So to do teacher and student wellbeing, we used the Warwick Edinburgh Mental Health Scale, and that's validated for use in adolescents and adults. So it's just 14 statements asking about people's wellbeing. For student psychological distress, we used the Strengths and Difficulties questionnaire. And for teachers' depressive symptoms, we used the Patient Health Questionnaire 8. We did some statistical analysis. So initially we looked at, we wanted to know about the associations between teacher wellbeing, which is highlighted on the slide in red, and then student wellbeing, and separately student psychological distress. So we did 6 models, and we added different factors in at each stage of the models. So the initial model 1 was sort of a crude association. So it was just teacher wellbeing with student wellbeing, and then just teacher wellbeing with student psychological distress. And you can see where I've highlighted all the numbers in red means that we found significant findings. So we found a significant finding between those 2 associations. The numbers with minus signs next to it means that as teacher wellbeing goes up, student psychological distress goes the other way, so it goes down. So it's like a negative association, and that's how that works. So model 2, we then included individual student factors and school factors. So the individual student factors were gender, whether they were entitled to a free school meal, and ethnicity. School level factors was teacher-student ratio, number of students at the school, percentage of students eligible for free school meals, school rating, academy status, school attainment, and the region the school was based in. And again, you can see that there was associations with teacher wellbeing, student wellbeing, and student psychological distress, even when we accounted for those other factors. So nothing really changed there. Then we go down and we put in the model the student-teacher relationship, and also included all those other factors I've talked about. Again, it was associated, but if you look, the numbers are slightly lower, which means there's a slight weakening of the associations when we account for student-teacher relationship. So something's happening with that, including that in our analysis. So then I'm going to skip down to model 5. We then put teacher absence in the model, and again associated, and it's a slightly stronger association, if you can see there. The model 4 and model 6 both included teacher presenteeism, and we found that the associations were then lost. This is why I've circled them, just to highlight that, and they're in black, so that highlights that. So by putting that in the model, in the equation, it looks like teacher presenteeism is having some impact between teacher wellbeing and student wellbeing, and then obviously teacher wellbeing and student psychological distress. I'll talk a little bit more about that later. So then we ran the same models, but now looking at teacher depression instead of teacher wellbeing, but with all the other factors included. And if you look down, it's the same pattern of events, with all being significantly associated, the ones highlighted in red. And again, we have the same pattern where teacher presenteeism is in the model, the associations are lost. So this is, again, we feel there's something happening between teacher wellbeing and then again when we ran the models with teacher depression. Just to summarise, better teacher wellbeing, we found was associated with better student wellbeing and lower student psychological difficulties. And then we ran the model again, so lower teacher depressive symptoms was associated with better student wellbeing. However, in the blue box, as you can see, when we included teacher and student relationships, the associations were weakened. And then when we included teacher presenteeism, the associations disappeared. So there's something happening. We feel that those factors are somehow mediating the relationships between the teacher factors and the student factors.
So will you need to do something?
We will. Yeah. I'm just going to run through the strengths at the moment, and then I'll talk about the limitations, where we pick up what we're able to conclude, and where we go next as well. So yeah, absolutely. Thank you, Joan. So the strengths of the study is that it's the first study. It's unique in being the first study to examine associations between teacher wellbeing and depressive symptoms and student wellbeing and psychological distress. Questionnaires were robust and well used in research, so we know that they were very strong questionnaires. We also had a large and representative sample recruited from the 25 schools in England and Wales. So again, we know that that's a good sample. And we had a high response rate from teachers and students. So we had a minimal of missing data. So that reduced the likelihood of any bias in our findings. So coming to the limitations now is the study's cross-sectional, which means we collected data at one time point. So it was a snapshot in time. So all we can talk about is associations and no causal factors. So all we know is there is an association. We don't know what causes what. It could be poor teacher mental health is influencing student, or vice versa. We can't actually say, but we know there's an association. What would need to happen for us to be be able to sort of draw more conclusions from the data? We'd need further longitudinal or over a longer time span research, or randomized control trials, which this obviously we used baseline data from a randomized control trial and a longitudinal randomized control trial. So hopefully, as we look at data that we collected further along during the trial, we'll be able to draw some other conclusions and maybe look at more causal factors rather than just associations. For pragmatic reasons as well, as I said earlier, we had to calculate an average of teachers' scores. So that gave us only 25 data points. So that actually gave us less data to look at than if we were looking at individual teacher factors. So that was a limitation. Also, some of the measures, the ones where we asked teachers about the teacher-student relationship, that was actually developed by the WISE team. And so again, it hasn't been validated. Student teachers measures on self-reported absence, so the teacher measure rather, on self-reported absence and presenteeism, it was also developed by the WISE team. And it was also, we asked people retrospectively how many absences you've had, so it could be influenced by recall bias, so that would be another limitation. So the conclusions from the study is it builds on previous research that found associations between teachers' wellbeing and teacher presenteeism. The current study found associations between teacher presenteeism, student wellbeing and student psychological difficulty. So I said that's where the association got lost. So we know something's happening around teacher presenteeism. And it may be that teacher presenteeism is on a causal pathway, but we will hopefully know more about that as we go and analyse more data. Poor wellbeing and higher levels of depressive symptoms may lead to teachers underperforming at work, which may in turn affect student wellbeing and psychological distress. So those are kind of feelings that we have that might be influencing what's happening between those two factors. Okay, so that's my part of the presentation. I'll just hand over to Rhiannon just to sort of round up and say where we probably go next with the study. Thank you.
Thank you very much, Jill. That's great. So I'm going to just ask Rhiannon as she's sitting down. So what dates are we talking about in terms of getting the final reports?
So we've finished collecting the data now. So we're in the process of analysing it. So probably about Easter time, maybe, that we'll be in a position where we can start to release it or start discussing it a little bit more openly. Okay. So just as the last slide I had really just to reflect on some of the stuff that Jill was saying about is that historically we have seen a lot of interventions to improve student wellbeing that have focused on individual level approaches, and this has really started to change, and I think that's what a lot of our work is trying to achieve, and some emerging work elsewhere. But I think the key is starting to look beyond the individual skill sets and particularly think about different relationships that students might have. And as Jill sort of said, this is one of the first studies which really looks at staff wellbeing, and that's important to student wellbeing. And I think moving forward, it's being mindful of the opportunities and the challenges that we have in terms of looking for additional opportunities to improve wellbeing. So in Wales in particular, we're obviously undergoing significant curriculum reform. And it's those sort of higher level structural changes which I think are important in reflecting on how we might respond to some of this knowledge we have about relationships and how curriculum reform in particular might really privilege staff well-being and its impact on students. So that's the end.
That's absolutely fantastic. Thank you so much. It's been really interesting and so sort of current, and as you say, with all the changes that are happening, to be mindful of this when we're looking at wellbeing issues in school. That's absolutely fantastic. So thank you both very much. Yes, I'm going to ask Rhiannon to share some exciting news that she has related to some other work she's been doing, which
I'm not sure it's exciting.
Oh, it is. It is.
So, well, if you attended the original seminar webinar of this, it was just talking about the study we probably did a couple of years ago, where we'd asked all of you to survey what your current practices and approaches are around student self-harm. So that paper was actually published yesterday, and I had spoken about the contents of that paper to the Welsh Health, Social Care and Sports Committee earlier in the year around suicide and self-harm prevention. That report was actually published this week as well. So I think Joan might be willing to circulate those, because they're all freely available.
Yes.
So the key thing that came out of the paper really was how useful people found CAMS and counselling to address student self-harm. But the big evidence gap that I think came out quite a lot was only 52% of schools that responded said that they'd had some staff training around self-harm, and where they reported the quality, I think only 22% of people who responded said they thought the quality of staff training around self-harm prevention was high. So I think that's a real gap for us going forward, of trying to improve staff training about how they support students who might engage in self-harm practices. So we can circulate those, and hopefully that'll be of
certainly
use
do
to
that. I mean, I'll probably put it in our newsletter, but you know, obviously, if you watch this, they should be up on our website under the research tab, so you can check out there. But do just get in touch with any queries. Just on that point, we do have a PhD looking at sort of following up some of that self-harm. Again, it's going to be a watch this space in the future, so it's a sort of continuing piece of work. Well, thank you very much.
Great.
That's great.
Thank you very much.
I'm just going to take this opportunity just to whiz through a little bit of network news. So some little dates for your diary, so early in the spring term you'll be asked to complete a very brief questionnaire on how you're using your student health and wellbeing reports in schools, and we're really fascinated to read how that's going. The newsletter will be, it's nearly in completion, so you'll be getting that before Christmas and again in the new year. Just some dates. When we first sent the dates out, we didn't have titles for the webinars that are going to be coming up, but we now do. So we've got on the 30th of February, we're looking at trends in tobacco and e-cigarette use in young people, and then on the 28th of March, Hannah Littlecott, who has presented before, but is going to talk about the relative roles of school support staff and teachers in student health and wellbeing. So we're sort of building up a real body of evidence in this field. So that, I think, definitely dates for your diary. And the summer events for the schools, we absolutely love seeing you and sharing practice and picking your brains as to what are your sort of health priorities that we can work on. So we've got the dates and the venues for those. So get them in the diary, because it's really valuable. We know from the schools that have come in the past. And just one thing which is now out of date, so I'm not going to push that, but Cancer Research UK may well be doing it again, looking at young women working in cancer research, so we can keep you informed about those. And I think that's it. So I'm going to stop there, and thank you very much for listening to our second recording of this webinar, and we'll obviously be back in touch and doing webinars in the new year. Thank you very much. Bye then.
Bye.